Good afternoon, everyone. Today's topic is antihelmintic drugs, and antihelmintics drugs are used to treat the worm infestation within the intestinal tract, and uh, the classification of the helminths includes flat worms and round worms. Round worms, also sometimes called nematodes. And flatworms are further divided to cestodes that are longer one and gematodes that are actually flukes. Then roundworms or nematodes are divided to ascarids and pinworms. So this is classification of the helminths and the drugs that are used for the treatment are further divided according to the type of the helminth. So says for the treatment we have anti-nematodal, anti-trematodal, and anti-cystodal drugs. Uh, so for the anti-nematodal drugs we start with the albendazole because this is the primary drug for the treatment, and the second one is mebendazole. So if you want to remember the most important drug, this is albendazole, and secondary is mebendazole. So we also have the ethylcarbamazine and ivermectin and pyrantelapamide. The first drug, albendazole, has a broad spectrum of activity, and it's highly active against the uh, uh, most of the worms, and metabolite of albendazole is sulfoxide that is acting on the hydatid cyst and killing the cyst, and then they have this albendazole has a broad distributions throughout the tissues, and the mechanism of action is binding to the beta tubulin microtubule and inhibiting the polymerization of the microtubule, and also it inhibits glucose transport in the parasite, so parasite is immobilized and dies. Side effects are rare, but long-term use can lead to the hepatic dysfunction and also the uh, uh, some chronic uh, neurocysticercosis, uh, and the most commonly used diseases are caused by nematodes, uh, hydatid cyst, and filariasis, and also schistososis. The next drug is the mebendazole. and it has the same mechanism of action, and mostly administered orally and excreted in feces mainly, and is contraindicated in children less than 1 year and pregnant women. It is used in the intestinal nematodes, and it's in this case it's better than albendazole, and also in trichariasis. The next drug is diethylcarbamazine, uh, the um, and it acts by damaging the microfilarial membrane, which is then killed by the host defenses itself, and it's safe in pregnancy. And one side effect that is a hypersensitivity reaction known as the uh, hyper um, uh, sensitivity, and the uh, and also uh, can be treated uh, in combination with the uh, et, uh, ethyl carbamate. Uh, and the hypersensitivity reaction is because of the antigens that are released by the microorganism after the death, and that leads to the hypersensitivity. Can be treated with the antihistamines and glucocorticoids. Uh, the next drug is ivermectin. Uh, Ivermectin acts by opening fluoride ion channels and increasing GABA activity, um, and that leads to the hyperpolarization and contraction of the gut wall of the microorganism, and is used for the treatment of the filariasis. Um, and like the worm will be just paralyzed and will fall off from the gut wall, um, and then removed with the thickness. Then the next one is pyrantel palmate, is a nicotinic muscle type receptor agonist, um, and its stimulates will lead to the contraction, uh, and that leads to the paralysis of the worm, and it also will fall off from the gut, and is drug of choice uh, uh, for the filiancy, uh, and it decreases transmission also uh, in because of the increase in the calcium influx. So the next group is antitrematodal. So the first drug is praziquantel. Praziquantel will also lead to the paralysis because of the increase in the calcium channel influx. And the second mechanism is increase in vacuolization that leads to the cell death. Uh, and it also metabolized in the liver and binds to the protein highly in the plasma. First pass metabolism in the liver decreases concentration. Adverse effects include dizziness and also and used in schistostomatosis and neurocysticercosis, contraindicated in pregnancy. So it uh, can be used as an alternative drug or instead of the albendazole because of the same indications. Um, and the lastly we have anti-cystotal drugs that uh, same drugs are used for the treatment. Albendazole, mebendazole, praziquantel, um, and niclosamide is uh, the closest. The amide is niclosamide is inhibiting oxidative phosphorylation, and that kills the worm, adult forms of the worm, uh, and uh, this leads to the decrease in the number of the worms. So, uh, then if we look at the distribution of the diseases, the most commonly seen infections are nematodes, and that includes Ascarides, hookworms, Filaria, and Trobius. Then the less commonly used is trematodes, like schistosomes, then cestodes, only tapeworms. These are the longest worms in the world. Some of them can be up to several kilometers long, and also some strongyloids and trichinellas. And the distribution is provided by the uh, 2016. The year 2016 was this kind of. So good news is that there is it's not endemic in European part of the Russia, and mostly the diseases is uh, South Africa and Latin America, and also some uh, Oceania and Asian countries. So and uh, although this not all data is presented here, like for example for some regions there is no data available because of the lack of the, like for example here I think because of the Sahara desert, and here maybe also the villages that are far away from the civilization. Okay, so and I think that is all for today. Thank you for your attention and see you next week.